Okay. And share my screen, and we are ready to go. All right, we're looking at the ViaQuest screen. Yes, awesome. All right, perfect. All right, ladies and gentlemen, let's get this started. All right, so this week we intervention number 9, mental health interventions. Hey, we're on the downhill slide. Yay. All right. So to start off with, let's talk about last week just for a second. So you guys had some good notes this week, like all of you did. Great job. So what activities, if I can get just maybe 2 or 3 of you, talk about your activities. Pearl, go ahead.
So I did journaling with a client last week. It was only my second time meeting them.
Hmm.
But she just expressed that she was really struggling with socialization. So what we
Yeah.
did was actually journal out some different days of the weeks, and I went through the calendar and we discussed, what they were having going on at the facility. And she was able to pick 1 or 2 things she wanted to try that week then to just engage with others, which I thought was really exciting.
Nice. Nice. Thank you. Anna, were you right? Anna Jenkins, were you raising your hand? Okay, go ahead. And then Holly.
Yeah, I had a client that I had tried to do journaling with before,
Hmm.
and she was really struggling with it. So I sat back down with her and we talked about the help that journaling can do for her.
Uh-huh.
And she was so cute because she pulled me aside the next day and said, "You have to come read my journal. I wrote in my journal." She
Oh,
was ecstatic that she wrote something in her journal. So it was just so cute that she was excited she had to
yeah,
share it with me.
that's awesome. That's so positive. All right, Holly, and then Ariel, and then we're going to move on.
Okay. So my lady actually has a diagnosis of bipolar, and she has been noticing that she has highs and lows. And last probably 2 weeks ago, she was at a very high, talking about family interaction, was attending activities, and then all of a sudden she just went to total low.
Oh,
So we actually went over the handout that we have in our workbook about all of the signs, symptoms, and then try to identify her triggers and then what events and then what we can do to kind of move those symptoms and decrease and have her increase activities.
nice. Nice. Thank you.
Yes.
That's awesome. And then Ariel. Now, after Ariel, we're going to keep moving after that. Go ahead.
The gentleman that I sat with, he was having an increase in depression and anxiety and issues sleeping because of sleep apnea. And
Yeah.
he was saying that basically he feels no one listens to him. So he's like the people in the staff, the psych nurse,
Okay, I
everybody. So
remember
he
your
was
note.
switching.
Yeah.
Okay, so he was
Yep.
switching over to Signature
Signature.
Health.
Yeah.
Yes. So he was saying that he really can't, when he tried to journal, he can't concentrate long enough. So I kind of
Good.
told him in the past, I just record myself. I take my phone and just record because he wants to remember everything. So when he
Yeah.
goes to his therapist, he can mention certain things. So he said that he's going to try doing the journal from recording itself on video.
That's awesome. Yeah, I like that. I remember that. I like that note a lot. Just like you're still doing it. You're just thinking outside the box. You're making it work for
And
him.
you got to be truthful with yourself. So.
Yes, that's true. Yeah. Awesome. Oh, you guys are so great. I love it. Love it. Love it. All right. Um, so just a reminder, the progress notes need to be turned in from sessions conducted this week. We're looking to see how TBS specialists implemented the intervention activities that are covered in TBSU. So just again, just a reminder not to turn in old notes. Just make sure they're in from the current week that we're in. All right. Any questions from last week before we move on? Oh, hold on. I got something in the chat. Yeah, that is an awesome idea. Pearl said, awesome idea, Ariel. Okay, here we go. All right, so mental health interventions by definition. This is just a little review from the Ohio Administrative Code. addressing mental health symptoms, behaviors, and thought processes to assist an individual in eliminating barriers to seeking or maintaining education and or employment. So that's what mental health interventions are by definition. So we just want to kind of be mindful. Wait, what? I'm so sorry. Her recording from my previous class just finished and it just popped up on my screen like, what do you want to do with this? Oh my goodness. All right, so be careful that we stay within our scope of practice, right? Just remember that we are not, TBS is not therapist. You're not providing actual therapy. We reinforce what is learned in therapy. That's what TBS does. You're working on any type of evidence-based interventions, and you should be coordinating with the client's therapist. The therapists are the teachers, and you are the implementers, right? You're the doers. They give you the plan, and then you figure out what to do with it, how to make it work. All right, so let's get started. So implementing mental health interventions requires most of the interventions that we've already covered in TBSU this far. They need to be implemented prior to or at the same time. So, and they may also include ongoing assessment of needs, coordination, skill building, education skills, symptom monitoring, right? It includes a lot. All right, so we are going to reference the first handout 9.1. This is the decisional balance. Hold on, let me pull that up for you. There we go. There we go. All right, so this is the decisional balance matrix. All right, so the decisional balance matrix is a small part of an approach called motivational interviewing. We'll be breaking down the decisional balance matrix later in the presentation, and then we'll watch a video to help further explain the concept a little bit. All right, but that's what that first handout will look like. So the basics of motivational interviewing. Now, we're going to give you a brief overview of motivational interviewing and just kind of the basic concepts. So the concepts of MI, and those will be discussed over the next few slides, are listening for change language, not giving advice, weighing the pros and cons, assuming a non-judgmental attitude, and being curious. Now, these concepts can be used while engaging with the client in activities, including the decisional balance matrix, as well as any other activities. So, MI, this is from the Motivational Interviewing Network of Trainers, 2020-21. MI is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. So MI is more of a way of communicating with your clients and listening for your client's level of readiness for change, and then pointing out that readiness for change, when you hear it. We are working with our clients rather than assuming a position of authority or that we are the expert on this. Some examples of change language that you may hear from your client. Expressing varying degrees of readiness to behave differently. So you might hear them say, I really want to lose weight. I could quit drinking. Or if I stick to my medication, then maybe I'd have better control over my diabetes. I can't keep eating this way. I'm going to exercise more often. So that's some of the language that you might hear when somebody is, they're ready. So what does change language communicate? Your client's expressing a desire, a wanting, wishing, or willingness to change. Your client is noting that they have the ability to change, and they're also pointing out a reason to change, a motivation, and an end goal. There is a level of need or urgency to change now or very soon. So the most current version of MI is described in detail in Miller and Rolnick, Motivational Interviewing, Helping People to Change, 3rd edition. Key qualities include MI as a guiding style of communication that sits between following, good listening, and directing, giving information. Guiding the client towards change and keeping them talking about change, pointing out the client's own reasons and motivation for wanting things to be different. And this guiding requires listening for change language and then pointing it out to the client when you hear it. So we're not, yeah. Sorry, I thought I skipped a slide. So three key qualities of motivational interviewing, right? So MI is designed to empower people to change by drawing out their own meaning, importance, and capacity for change. So we're not trying to convince the client, like we're not trying to talk them into changing. We're going to help them find their own reasons to change. So number two, like I just said, MI is designed to empower people to change by drawing out their own meaning, importance, and capacity. MI is based on a respectful and curious way of being with people that facilitates the natural process of change and honors client autonomy. And the third key quality, it's important to note that motivational interviewing is not a way to get people to change. It's about helping your client decide what, when, where, why, and how to change, right? It's helping them make the choice. So just a little overview. MI is particularly useful to help people examine their situation and options when any of the following are present. Ambivalence is high, and people are stuck in mixed feelings about change. Like they have strong feelings about changing, but also strong feelings about not changing and just leaving things status quo. Confidence is low, and people doubt their ability to change, their ability to do anything differently. Their desire is low. People are uncertain about whether they really want to make a change. And importance is low, and the benefits of change and disadvantages of the current situation are unclear. So you want to look for these indicators to determine if MI might be helpful for your clients. Whoops. Hold on. So Dr. William I don't want to say his name wrong, Matulik, PhD, is an experienced clinical psychologist, acclaimed motivational interviewing trainer, distinguished public speaker, and award-winning artist and best-selling author on the topic of motivational interviewing. So we're going to watch just a short video about him, or from him, sorry. And people need help changing, even when they have all the necessary information and tools to change, because change is so hard. So we're going to learn about using motivational interviewing to complete a decisional balance matrix. All right.
Hello, everybody. This is Dr. Bill Matulich. I'm a clinical psychologist, a motivational interviewing trainer, and the author of the ebook, How to Do Motivational Interviewing, a Guidebook for Beginners. Today, I'm speaking to you from my obviously plush and high-tech studios here in San Diego, California. Got my high-tech chart up here behind me. And today, what I'd like to talk to you about is motivational interviewing. Now, you probably already know that motivational interviewing is an evidence-based, best practices approach for helping people change their behavior in healthy directions. Now, in a lot
Oh, sorry. Shoot. Oh my God. Sorry about that.
situations in which we're sitting down with our clients and talking to them about changing their behavior, it's usually the health professional that's the spokesperson for change. It's usually the health professional that comes up with the arguments for change and tells the client what will happen if they change, what won't happen if they don't change, and lets them know what the consequences of their behavior are and so forth. The assumption is that if the client knows all of the information and understands the consequences of his or her behavior, then change should just be automatic. Now, unfortunately, in the real world, it doesn't work exactly that way. There's a certain number of people who are convinced by information and by advice to change their behavior. Unfortunately, there's a lot of people that are somewhat ambivalent, at least, and sometimes downright resistant to the notion of change altogether. And these are the clients, these are the patients that we have that are somewhat frustrating for us as healthcare providers. So these are the kind of people that motivational interviewing works with to help move them towards change without creating any kind of resistance. So how do we do that in motivational interviewing? Well, one way is by using the decisional balance to elicit a client's own arguments for change. We call that change talk. We know that the more a client will talk about change themselves, the more that they will argue for change themselves, the more likely it is that change is going to occur. And so that's what we want to encourage with our clients is their own arguments for change. One way to do that is the decisional balance. Now, the decisional balance is not much more than just a sophisticated kind of pros and cons list. The decisional balance asks 4 questions, which are based on what are the good things and the not so good things about changing your behavior and not changing your behavior. In order to be effective, or most effective, the question should be asked in a particular order, and I'll tell you what that particular order happens to be. The first question is one that most people don't ask. It's based on what are the good things about not changing, and so the question is really, what are the advantages of the status quo? Now, the particular content, of course, of the question will depend on the behavior under consideration. So if you are a dietitian, for example, and you're working with a heart patient who's eating unhealthily, and your goal is to move that patient towards eating more healthy foods in order to be healthier, in order to have some positive impact on his heart condition, the question you might ask, if you're using the decisional balance, the first question you would ask would be, what are the advantages of your current eating habits? What are some of the good things about your current diet? You want to get the person to start talking about the behavior under consideration in a non-defensive kind of a way. And this question is really going to do that. If you're an addictions counselor, for example, and your client is using, say, crack cocaine, your first question might be something like, what are the advantages to you of using crack cocaine? What are some of the good things about crack cocaine? It's not a question that most people would ask. It sounds like kind of a silly question. Why would you ask a person what are the good things about using crack cocaine? We all know what the bad things about that are. And typically, the question isn't asked. Typically, what happens with healthcare professionals is that we tell them what the bad things are about their behavior, or we encourage them to change their behavior. We tell them how it would be good for them to change their behavior. With the decisional balance, we start with the advantages of the status quo for a couple of reasons. One is that it gets a person talking in this non-defensive way, so it short circuits resistance right off the bat. You're not going to get much change talk there, though. The change talk starts to come with the second question. The second question is, what are the not so good things about the status quo? What are the not so good things about not changing your behavior? What's the downside of the status quo? And again, to use our examples of the heart patient and the person who's addicted to crack cocaine, the question might be, well, what are some of the downsides of your current eating? What are some of the downsides of using crack cocaine? This is where your client's ambivalence is going to start to come up to the surface. And ambivalence is a key component, a key concept in motivational interviewing. We need to pay close attention to ambivalence. But the important thing here for the purposes of this video is that you're going to start getting some change talk. The person's going to start telling you, now they've already told you what some of the good things about their behavior are. You've already made that connection with them. And now it's easier for them to start telling you what some of their concerns might be. And so that's what you're going to get here. The third question then goes back to what are the not so good things about changing your behavior. So staying in this column, the question is, what are some of the downsides? What's the downside of changing your behavior? And this again is a question that's going to short circuit any kind of resistance, because you're asking for your client to tell you in their thinking, what are their thoughts about what's the downside to change their behavior. You might start to get some of your clients' fears at this point. They're starting to think about, geez, what if I were to really change my behavior? What would that be like? I don't know if I can tolerate that. I don't know if that's going to be good for me. I don't know if I'm comfortable with that at all. So you're starting to get a little bit of their fears and some of their reluctance to change their behavior here. Very important information. Not much change talk there. But again, this is an area where you're short-circuiting any resistance because you're really asking to hear those difficulties. Question 4 is where you're going to get most of the change talk. This question has to do with what are the good things about changing your behavior. So what are the advantages of changing? You would ask your heart patient, what are the advantages of having a healthier diet? What are the advantages of changing your diet? What do you see as some of the good things about changing the way you're eating? Or you might ask the the person who's addicted to crack cocaine, what are some of the advantages? What are some of the good things about quitting using crack cocaine? Now, the important thing here is that you're getting change talk, which is your client's own arguments for change in their own words, their own way of thinking about it. It may not surprise you that some of the things that they're telling you are things that you already know. And you could have just given them advice in this regard in the first place. But it's important to know that this is coming from the client and not coming from you. And so when it comes from the client, there's no resistance. The other thing that might surprise you is that you're getting some advantages of changing their behavior that you might not have even thought about. Something that's just particular to that person, rather than anything more general or things that you might have thought about. And that's important information. That's really important and very key in helping your client move towards healthier change. So that's the decisional balance. What are the advantages of the status quo? What's the downside of the status quo? What's the downside of changing? And then what's the advantages or the upside of changing your behavior? Now, if you ask that question, you start to generate some change talk, and you can just kind of take off from there and continue with your conversation. Now, there's a few studies in the literature which suggest that just using the decisional balance by itself can be very useful, can be very helpful in helping a person move towards healthy behavior change. But it's probably much more likely and much more powerful, certainly, to use the decisional balance as kind of an integrated component with a full motivational interviewing session. In that session, you would be using other techniques like asking non-judgmental, open-ended questions, for example, or following up some of the change talk that you're getting with strategic kinds of reflections. And that would make this particular technique even more powerful. So I appreciate your attention. Thank you very much for listening. This is the decisional balance. Now you know how to use it to elicit change talk from your clients. If you'd like some more information about it.
All right. Good deal. All right, so Pearl had put something in the chat if you guys want to check it out.
I just took like a snippet of the screen, and sorry, part of it he was covering, so
yeah,
I saved it.
Okay, good deal. Awesome. Yeah, and thank you. I appreciate that. Yeah, so just a reminder, just make sure that we're following the clinical directive of our therapist, and we're going to go through each section of this, right, of the decisional balance matrix. All right, so just a review. So box number 1, and you guys all have the handout. I know, I'm sorry, I keep repeating that question. I just want to make sure everybody's got what they need. All right, so in box number 1, we're asking our client questions to identify a list of positives associated with not making any changes, with just leaving things the way they are, right? So I'm going to use the example of if I was thinking about joining a weight loss group, what could I have on my decisional balance matrix? All right, so if you guys would, I just want, and I've got some things here, but I just want to see what you guys might think. If this is about a weight loss group, joining a weight loss group, what might some advantages be of not making any changes? What are some things I might put? I'm sorry?
Feeling comfortable or like sustained right now.
Yeah. No extra effort needed.
Or you could eat all the good foods.
Right? There's 2. Give me one more, please. So what are the advantages of not, like, I can watch TV in my spare time instead of worrying about going to a group. I don't have to share my weight loss struggle with other people. I'm not really a people kind of person. I'm not a groupie kind of person. You know, I mean, we could come up with all kinds of reasons just to keep the status quo, right? To keep things the way they are now. But we want them. And again, this is from the client's perspective. And I mean, if you think about it, it makes sense. It's not us telling the client. The whole point of this is for the client to be able to work the reasoning out for themselves, right? Not us convincing them that, hey, we know better and you should do it just because we say so. This is convincing themselves to do it. All right, so let's move on to box number 2. These are identifying a list of negatives associated with, again, not making any changes. So you're asking questions here to identify the negatives associated with, again, not making changes. So if I decided not to join the weight loss group, I might have things listed. So what are the downsides? I'm not going to get any healthier.
Increased health decision or increased health problems.
Increase in health problems. I might continue to gain weight. Might not be able to get out and play with the grandkids. Maybe they're embarrassed to be seen with me because I'm so, overweight and unhealthy. But again, so what are the downsides, right? And then now we want to ask questions. In the third box, we're going to ask questions to identify a list of negatives associated with making the change. Does that make sense? So it almost sounds backwards, doesn't it? So you're asking questions to identify a list of negatives associated with actually making the changes. So continuing on with the weight loss example, I might have things listed such as my schedule is already jam-packed. Like I don't have time to fit a group in here. I'm going to miss my favorite TV shows when they come on because I'll be at this weight loss group. I would have to share my struggle with others. Oh my gosh.
And
And
give up certain things that you love, like food or
junk food.
nicotine. Yeah.
Yeah, for sure. I'd have to give up the greasy food, which is, I'm sorry, the best food ever. Or, so just making sure that, sorry, we're asking again here, just what are the things that are negative about making this change? And
Couldn't
then
they also couldn't they also speak about their fears about the
absolutely,
downsides of what's
yes,
going on?
it's
Okay.
whatever they feel,
Okay.
right? There's no right or wrong here. I mean, there really isn't. This is their perspective, their words, it's kind of like their journey, right? So whatever they come with, whatever they tell you, or whatever they choose to put in here. All right. And then in the last box, what are the positive associated with making a change? So again, sticking with the weight loss group, if I continue to get healthy and lose weight, I'm going to have more energy to play with my grandkids. I'll be able to keep up with them, right? I could lose weight. I could walk and run without losing breath. Maybe I could just be healthier overall, feel better, look better, have more self-confidence, right? So it's just, we're kind of going full circle. Like, here's everything I do not need or want to do. It's starting with number one and just kind of making that loop around to, you know what, maybe there are some bigger advantages than there are disadvantages, right? I love this thing. This is probably one of my favorite activities, I think, because it's very enlightening for people, just in general. All right, so next we're going to look at stages of change. So during this part of treatment, you may want to consider your client's readiness for change. And another way to think of this is how ready is your client to engage in new or different behavior? All right, does anybody remember the stages of change? Any thoughts? Anybody think they remember the stages of change? It's okay if not. We're going to go through them. All right. So we're going to break down each stage individually. We're going to Oh, did you guys get the stages of change handout? Okay, hang on a second.
I'll send it real quick, Stacy. Go ahead.
Okay, thank you. I'm sitting here because I think I might have. All right. So Kim's gonna send out that stages of change, and I'm gonna have you guys just take a picture of the screen because you're gonna need it for the activity on the next slide. All right. Thank you, Kim. Okay, so the stages of change, pre-contemplation, unaware one needs to lose weight, right? That's not yet knowing there's a problem behavior that needs to be changed. Contemplation, that's acknowledging, yes, there's a problem, but you know what? I'm not really sure I want to make any changes yet, or maybe I lack the confidence to make a change. So that's when we are aware that we need to lose weight, but I've not started exercising. I've not changed my eating habits. I've made zero effort, towards the goal of losing weight. Preparation and determination, that's when we're getting ready. The client's getting ready to make change. They're getting ready to do something. So preparation for the weight loss example, Maybe I'm printing out healthy recipes. Maybe I'm writing out meal plans. Maybe I'm meal prepping, visiting or joining a gym, purchasing workout equipment. You know, I'm getting ready to do this. Like I'm all in. I mean it. And then next we have action and willpower. That's displaying new behavior, right? So I'm sticking to my diet. I'm sticking to my meal plans. I am going to the gym X number of days a week. I'm doing great. Go me. And then we have maintenance. So that's just maintaining that behavior change, right? I'm maintaining the weight loss. I am, sticking with the new food and exercise habits, right? I'm still going forward. And then relapse. That's returning to the previous behavior and not maintaining the change. And, oh, excuse me, relapsed. I've returned to my old eating habits. I've started putting the weight back on. I don't exercise at all anymore. I barely walk my dog. Like I've just relapsed. I went right back to where I was before I started the whole change. All right. So some examples of change language. Now, so what I want you guys to do here is we're going to read each one of these. And I'm going to go through. There should be enough here. We should get at least 6 of you. I want 6 different folks. Why is that? I had my chat and it like took out my whole screen. All right. Did you guys see Kim added stages of change in the chat? Did everybody see it? Okay. Thank you. Thank you, Kim. Appreciate your help. All right. So we're going to read each one and have you state which stage of change that statement represents. Okay. So that's why you kind of need that previous one. So, and I'm just going to go down the way I see you guys on my screen. Okay. So Ariel, you want to take the first one?
I'm sorry, I was trying to pull up the stages of
You're
change
okay.
again.
You're
Okay.
okay.
You said read the first one. I'm making
Read the
changes
first.
to my diet to lose weight.
Okay. So if you're doing that here, I can I'll hop back over so you can see the list. Maybe that'll help. So what do you think that is? If I am,
And would that be preparation, determination? No.
yeah, hold on. Let me get back
Or
over there.
action.
I'm making changes. So which one did you say?
I had said
You said pre-contemplation.
preparation,
Oh, preparation.
or is it
Well,
action?
there it is. Action. They're actively doing something, right?
Mm-hmm.
Think of it like that. They're taking action, I guess would be a better way to say it. Good. Good. And it's okay to work it out, like talk about it. It's fine. Holly, you want to take the second one?
I'm not sure there is a problem when it comes to my drinking.
Do you need
I
me to
would
pull the
have
list up?
the pre-contemplation, not yet acknowledging that there is a problem.
Awesome. Good job. Thank you.
Thanks.
All right. Pearl, number 3.
Sorry, I was muted. I'm going to start taking my medication so I can have better control over my diabetes. I would say action for that one. Or
Do you want me to pull up the list?
yeah,
Okay.
sorry, I had it
No,
up.
no, you're fine. You're fine. Don't apologize. You're just fine. It's a lot of flipping back and forth, so you're okay.
So and maybe I'm wrong, but I would say
Okay.
action or willpower because he's actively trying to do something.
Okay, whoops, I went the wrong direction. All right. Actually, the third one would be preparation and determination.
Okay.
This is how they're going to reach their plan, right? This is how they're going to do it. I'm going to start taking my meds, right? That's what I'm going to do. I haven't done it yet, but I'm going to start. So I'm planning. Does that make sense? Yeah, but I
Yes.
can see where action comes in too, because it's like they're doing something, but they haven't quite done it yet. So you that going to start, that little phrase there, that's what kind of get you. All right, good job. Number 4, who do we got? Anna Jenkins. You're the next contestant. Unmute. There you
Sorry,
go.
it was,
You're
I kept pushing
fine.
it and it would go away.
You're okay.
I'm weighing the pros and cons of my eating habits. And that one would be,
Do you need a list?
is it pre-contemplation
You're close.
or contemplation?
There it is. They've acknowledged there's a problem. They're just not sure if they want to work on it just yet. Like, maybe, maybe not. So that's where you just continue working with them, right? Until they can kind of see that enlightenment themselves. Where are we at? Number 5. Da-da-da, Tracy Poling. You're up.
I'm sticking to my exercise regimen and my healthy diet.
Do you need the list?
Yes, please.
So I'm sticking to my exercise regimen and my healthy diet. What am I doing?
Would that be maintenance?
Ding, 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 ding.
Yay.
Nice job. They've implemented the change. They're sticking with it. They're being consistent, right? Yay. All right. And last but most certainly not least, who else we got? Who have I not? Miss Kaya, you're up.
Last one says, I'm not sure what happened. I had a plan, but I ate a box of Twinkies last night. Can you go back to
I
the
can.
thing?
I got you. So I'm not sure what happened. I had a plan, but I ate a box of Twinkies.
Let's say it's relapse,
Ding,
returning to
ding,
the
ding.
previous behavior, but not
Yep.
maintaining the change.
Tearing them Twinkies up.
I love
Right.
them too.
I had a hiccup in the road and returned to the previous behavior. Great job, guys. Very, very good. So does this make sense for y'all how this works? Right? How do we feel about it? What do you guys think about it? You think it'll be helpful for you got anybody in mind yet? Like Wendy's like, God, yes. Awesome. All right. So you listen for the change in their language. Then you'll determine where they are within those stages of change, right? Are they ready? Are they not? Like that's what you're going to use to help you figure out where they are. Whether it's pre-contemplation, contemplation, preparation, action, maintenance, or relapse. You can figure it out from the language they're using. All right, so handout 2, the ABC whoops, this goes over CBT basics. Sorry, I just realized what I cut my own screen off. Good grief, Stacy. All right, so CBT, cognitive behavioral therapy handout. In response to an antecedent or an activating event, that's our A, we work with the client on changing their beliefs, right? That's our B. In order to create more positive consequences. That's our C. So this is our cognitive triangle, right? Let me grab that handout for you real quick. This one. Oh, get over there. Come on. There we go. All right. The ABCs of CBT. Right. So the name refers to the components of the model. And again, so CBT focuses on changing the beliefs in order to create more positive consequences, right? Because our behavior is based on what we believe, like what we believe to be true at the time. All right, so this is a blank one. You guys were also provided a blank one with your handouts. So this will kind of just walk through the ABCs. All right, so let's kind of go through these. So what was the activating event or the situation? And then what are the beliefs and thoughts about A? So whatever the situation is, what do they think about it? Click. Nice. Okay, and then what are I didn't think my slide moved. Oh my. I'm having a Monday morning, folks. Thank you for being patient with me. Cheesy cow. All right, so what were the consequences? Like what were the feelings, the behaviors, the emotions um, of those beliefs? All right, so hold on, sorry. I'm having a bad part. Okay, so let's get into our progress note. Oh, all right. Can you guys see this okay? I don't know if you're on phones or computers. Do you need me to blow it up? I'm not gonna read it to you. I'm gonna let you guys take a minute and read this. If you need me to blow it up, please let me know. If you would. All right. Am I getting through it? Okay, so now we're going to figure out how we might do a decisional balance matrix with Sally, right? Based on the information that we have right here. All right, so let's just take, therefore, we're just going to have a little discussion on this. So if we go back to our, oh, shoot, wrong one. The decisional balance matrix, how might we do this? So what would we start with? What would be the advantages of not making any changes?
Well, she's already attending activities regularly,
Mm-hmm.
and so maybe she feels like, maybe she is okay with where she is. She's not having as many panic attacks, significantly less. So,
Good.
she's made a good bit of change. So maybe she just wants to try to maintain that instead of getting anxiety over trying something new.
That's great. Thank you, Tracy. That was like really good.
She gets to continue TBS services.
Hey, like right
Yes, you
there.
can't
That's
discharge her.
right. Get to keep my buddy.
Right.
Perfect. All right, good deal. Okay, so then what's our next step? Who can tell me the next step? What's step 2 for the decisional balance matrix? What are we
Asking
looking
her what
for
the benefits of changing the behavior.
of not changing the
Yes, of
behavior?
not changing.
No,
Sorry.
that's just that three-letter word just change everything. But no, what's the benefit of not making changes? So what might we come up with there? Just based on what Holly and Tracy gave us, right? If we keep status quo, I'm not going to have anxiety about making any changes
Yeah,
or
she doesn't have to have increased symptoms by adding more goals. If she feels like she's already made good progress, she probably doesn't want to add more progress. Does that
okay.
make sense?
Yep, sure does. All right, give me one more. What's another reason to not make a change or a disadvantage to not making a change? Got to keep paying that TBS bill. I mean, if nothing else, I mean, you just got to make your copay or I don't know, whatever the insurance, or
Well, her
that's
not
still
getting
more time.
discharged. Her
Yeah,
not
she's
getting
not getting
discharged.
discharged. So maybe that hinders any plans she might have had, coming up. All
If
right,
that's what
good,
she
good.
Wanted.
Yep, good. You guys are on the right track. Okay, so what's next? Third step. Dun-dun, dun-dun, dun-dun. That's
The
Jaws, right,
downside,
Leslie?
the downside to no change is you're not going to get discharged. If you want to get discharged and go home, you're not going to get discharged and go home if you don't make the changes.
Perfect. All right, so hold on a second. Give me just a second here. Let me grab. Where is no? Yes. Oh, I already had it open. Jiminy Pete. Okay. So that's one downside to changing. What's another downside to changing? Here, let me jump back over so you can see this. There we go. So what would another downside? What would a downside to changing be?
It may increase some anxiety.
Yeah, because change is scary, right? Change is
Yeah,
hard. May have increased anxiety. Absolutely.
take her out of her comfort zone of the skills that she's already learned.
Yeah. So maybe she feel like, oh crap, now I gotta learn more. Like, what am I
If
gonna do
it's
now?
something that she hasn't done before, also, she's going to have a lot of apprehension,
Yeah.
which could cause a lot of issues. And she's anything like me, she's going to be like, oh, I don't want to be in front of a bunch of people trying to
Yeah.
learn something new, and then I mess up and make a mistake. And
Yeah, embarrass myself or yeah,
yep.
absolutely. That can, your self-confidence can take a hit when you screw. I mean, we've all been there, right? At some point. All right, nice job, guys. Oh, wrong way. And then what would our last step be? What are we looking for now? What's the last one? What are the advantages to the change?
She gets to see her friends more, and that was one of her goals, was she wants to get out and see her friends more.
Yeah,
And
awesome.
work towards discharge.
Yeah. So Perfect. And then, she would have the skills of, she's learned her calming skills, her coping skills, right? She's become good enough with those. So you see, it all kind of ties together, and then it still ties back to the goals and the objectives, right, of what they're trying to do.
Of
All right.
her feeling like herself again.
Yes, there it is. Ta-da! There's that golden thread, ladies and gentlemen. Oh, wait, do we? All right. Any questions? Hear that? All right. Really good job, guys. Thank you. Thank you. Thank you. All right. So there's our Sally. So let's look at our interventions for our progress note. Mental health interventions. So what do we want to select here? We'll just stick with a decisional balance matrix. What do we got to select under mental health intervention?
The second one, utilizing evidence-based treatment.
Nice. Good job. Perfect. All right. So, and then the handouts provided by the therapist, right? Got to come from somewhere. All right. So let's get to our focus. So, what is your feedback? And again, can everybody see this okay? Can you guys read this? What can we do? How could we incorporate a decisional balance matrix? Like, what do we need to do with this? This is making my head hurt. How can we fix it? Thoughts? All right, what you got, folks?
That's a whole lot
I
of
was
stuff.
thinking that in sentence 3, when she mentioned that she wanted to do yoga, maybe we can do the decisional balance in regards to her wanting to start yoga.
Yes.
Good.
That's what
Nice.
I was thinking.
Yep. You could do it. I mean, honestly, you've got activities, if we could do one with going or not going to activities, how is it helping? Great. Like you could do that with any of them. Good job. Yay.
Could you do something with the increase and decrease of anxiety? So she's
Absolutely
got the
good.
panic attacks. So do the advantages and disadvantages of the panic attacks
Yep,
and
of
the
not
anxiety?
maintaining. Yeah. Yeah. Because yeah.
In the
But what works,
depression. She
what
has a
doesn't,
depression.
you could honestly make it work for whatever you
Okay.
want. You know what I mean? Like I mean, it might take some thinking, like
Right.
some thinking out of the box a little bit, but that's okay because
Okay.
every client is unique, right? There's not a just one thing. We make it fit the client, not the client fit the activity, if that makes sense. So we can make it adjustable for them because I see people use, between IDD and LTC, they're night and day different, but they can still utilize those same activities, right? We just make it fit the client and their needs.
And basically, like the doctor said, that first question gets them started, and it
Yes.
usually just the ball just keeps rolling from there.
Yeah. And sometimes you hit a flat spot rolling down the
Yeah.
hill, and that's where
Give
TPS comes in.
give them the
Yes.
lead.
But that's where you guys come in, right? You're supporting them. You're just going to give them that, you push them on down the hill. Like, let them keep going. But I mean that in a good way, right? Awesome. Good job, guys. Truly. All right. So what would we select here? Based on what we've got, what would we select?
Maybe address barriers.
For
Mhm.
certain.
Participated and engaged.
Uh-huh.
Motivation demonstrated.
Yeah.
Identified symptoms, identified needs.
Yeah.
What about demonstrated knowledge, like of themselves?
Okay.
Like for that
We
point?
talked about discharge. Would we do end of treatment?
Well, we're not. Are we discharging?
No, but we talked
No,
about it.
Yeah.
no, I
I
think
I
that's for
wouldn't.
like at the end.
Yeah, I think that's when you're like done. Address barriers. I mean, there really is a lot here, right? Okay, moving on. Whoop. Okay, so for the homework. Oh my heavens, I'm getting click happy here. Jeez. All right. So, we usually kind of give you the homework and tell you how can we make it better, but we're going to do it a little different this time. How can we do homework? What would you assign as homework? What would you give them?
For them to continue to go over the advantages of the change and the disadvantages, maybe do a task analysis list on their end, or make them a copy of the decision balance square for them
Yep.
to fill out and give
Yep.
back to you.
Absolutely could. Now, like with the decisional balance, depending on your client, like maybe start it with them before you kind of give them his homework, just because that could be overwhelming, trying to come up with that kind of stuff. You know what I mean? I might see how they feel about it before I like start it with them and then let them finish it as homework, maybe. Does that make sense? Just to kind of make sure they're getting the appropriate and the correct grasp of what they should be doing. That
Yeah,
can be confusing.
or do like a whole one with them and then leave that one with them and a
Yeah.
blank one. Maybe
Let
something
them
will
refer back
change
to it.
once
Yeah.
they start to think about it.
Yep.
Could we do like a pros and cons for homework?
You
Have them write
absolutely
down
can.
your pros and your cons of doing what your goal is.
Yeah. Yes, you absolutely could. Absolutely could. But again, being mindful of your client's capabilities, do they have the supplies? And I will never out of all the TBSU classes I've done, this one has always stuck with me. The homework was the client was blind. The client was going to make a list of coping skills and activities that they wanted to. Yeah, that was my face, Holly. That was my face. That was so my face. And I'm like, okay, the intent is good. You know what I mean? You're on there, but do they have the things provide, do they have, so again, just making sure that your client, when you're assigning that homework, make sure it's something that they're able to do, that they have the supplies, if that's the thing, or the capability,
right? Approach.
The cognitive ability.
Yeah. Right idea, wrong approach.
Yes. That's it. But but like I said, their heart was in the right place, and it was just like, and she's like, oh.
And that can depend on wording too. She could have just said,
absolutely,
staff's going to help assist.
Yes.
Make a list.
Absolutely could. Yeah. So it wasn't anything wrong. It was just like, ooh. I think that was one I sent to my boss going, am I crazy? It's just me. All right. Nice work, everybody. Really nice work. All right. So as always, we're trying to work ourselves out of a job, right? We're always working towards discharge. So during treatment, you may want to start preparing your client for discharge. Make sure everybody relapses, right? That it's a usual part of the stages of change. So relapse, it doesn't mean that they're a failure. It doesn't mean that they did anything wrong, right? Just again, normalize that for them, because we feel bad when we fail at something. I don't care who you are. I know me personally, if I don't reach a goal, or if I, whatever, when I was trying to quit smoking, when I relapsed, I was so upset with myself, so upset with myself. I felt like a failure. We don't want people to be that, right? It's normal. You'll just pick yourself up, dust yourself off, and try again. So what can we put in place to reduce the likelihood of relapse of MH symptoms? Sorry.
Positive affirmation.
Yeah, there's one. Positive affirmation. Good. Somebody else give me one. Who have I not heard from today, actually? Who have I not heard from? I feel like I maybe have heard from, I think at least all of you, at least one. Miss Lynn, I don't think I've talked to you today. She's like, I'm hiding in the corner. Don't look at me.
Remember my chat? I can't raise my hand.
Hi, that's right. You're okay.
When
You're
I be doing like this, nobody see me. So
I didn't, because I could only see like 3 or 4 of you at one time on my screen.
Okay.
So yeah, don't you speak up. You speak up, woman. That's okay.
What was the question? I'm sorry.
I forgot to. Good gravy. What can we put in place to reduce the likelihood of relapse? Like what's something that maybe we'll put in place for Sally to kind of keep her going backwards?
Well, being positive weekly is the word I'm looking for. Like every week, meet with her, track her progress, encourage her, praise her for the things that she is doing, while encouraging her to maybe go back to yoga class, but just being there for her to support her in a positive way.
Good deal. So now, thank you very much, Miss Lynn. So what if our client does relapse? What should they do? Give me somebody. Who have I not heard from? Who else have I not heard from? Oh gosh, Kim, I almost called on you. Like, who have I not heard from? I haven't heard from Kim.
You can call him.
Oh, my mercy. All right, we'll leave it at volunteers.
I was going to say, when they relapse, just remind them that it happens and that they're not a failure. Just,
Right.
let them know that. And sometimes I'll even share a little bit of a personal, like I don't go deep,
Right.
but I'll share a little personal, like, I was doing this and then XYZ, and then, oh, I had a bad week. I
Yeah.
had to go back and remind myself it's okay.
Yeah.
Just keep trying.
Good. And that's part of normalizing it, right? It doesn't mean you're a failure. It just
No
means,
one is
okay, we're just
perfect.
going to start again.
I
That's it.
remind
And
everybody
then,
that nobody is perfect.
yep, that's for
And
sure.
Yep.
also remind them of their progress, because I just went through this with somebody
Good.
who was feeling down when they fell, but I made them feel better by like, but look how much you have done. Look how much you have accomplished. It's a wonderful thing. This is
Yeah.
just a pebble in the pond. We can get through this. So
Yeah.
sometimes just remind them of how good they have done, what they have accomplished, what they have
Good.
overcame.
Nice. That's excellent. Thank you. You guys are awesome. Okay, I'm going to have to rush here a minute because somehow we went from 15 minutes left to 1 minute left. Not a bad thing. All right, so you guys have a good idea of how you're going to provide the intervention of education and training using any of the activities, this ACT, the decisional balance matrix. And if you're not sure about something, please reach out. Like, reach out before the due date, reach out before. If you have any questions about anything, please reach out. Now, your week 9 homework. You've got your quiz. You also need to complete a decisional balance matrix with one of your clients, and you'll turn that in, and turn in your progress note from that session as well. So you're going to turn in the decisional balance matrix and your progress note and quiz. Okay. Any questions there? And you can do it by hand, type it. Like, I don't care what it looks like. It don't have to be all fancy and pretty. Like, you can just
Do you
write
have
it
to
out and
do
scan
we
it.
just scan it? Is
You
that what you
can.
said?
Yeah, you can.
Scan a balance square. I'm gonna call it the balance
You
square.
call it whatever you like. All
Just
right.
for clarification, you
Yes.
said so. Like we have to print the sheet out, do it with our client, and then scan it and submit that to you.
If you can take a picture of it, like if that'd be easier, you know what I mean? Like,
Yeah.
and honestly, if you're not going to be near a printer, like over the next week or so, I really wouldn't break my heart if you just drew one out on a piece of paper and took a picture of it. You know what I mean? As long as it's got the 4 boxes and the content. I'm looking at the content, not the paper it's printed on.
Okay, cool.
Does that make sense? So don't
Yeah.
overthink it. It don't have to be too pretty.
Okay.
Draw it out on a scrap of paper, just legible. That's all I ask for is legible.
Will do.
All right, is that okay?
Yep.
I got a
Yes,
quick
good.
question.
Sure thing.
So with the, I'm assuming instead of it being 2 submissions, instead of being 1, it'd be 2 submissions, correct?
Yeah, well, you can.
Because if we have to do
Yeah,
the
because you can
progress
only
note, we have,
upload.
Yeah,
you
the
can only
quiz
Are
upload
form,
they?
one.
the
So how
quiz
do we
form has an
upload?
option to upload two documents.
That was what I was looking
Okay.
for. You can
Okay,
upload
good.
2. Okay.
Okay, thank you.
I thought it did, but then I'm like, oh wait. All right,
Okay.
good deal. Thank you, Kim. All right, and then hang on, we got something in the chat, and then one thing. Okay, Ariel, that's fine. So for next week, or not next week, 2 weeks, the 10th is your final. Okay. So in addition to the final exam, an actual quit, you're also going to turn in 2 progress notes of clients that you've provided services for during this series. Right. So anytime you cannot turn in a note that has already been turned in. And the 2 notes have to have different interventions. Like they can both have achieving independence, but one better have skill building or a different. Make sense? Okay. Your notes need to represent the best version. Ensure again that there are different interventions. Now, on that same date, the 10th, because next week is week 10 for us, right? It's our last week of. So on October 10th, your week 10 homework is also due that same Friday. So you're going to have one more week 10 quiz and progress note. And then you're going to have your final quiz and progress notes. Those are 2 different things, but they are both due on the same day. They are all due October 10th. Now, I'm going to be sending you after class today. You're going to get a link for the final to submit you can start putting your progress notes on it. Like if you want to go through them or find them or whatever, just do not submit it until you have it completed, like fully completed. Again, your week 10 homework will be due the following Friday, just like or the 24 hours before the following class. And you will also be sent the link for the final. You guys have a placeholder on your calendars now, but that doesn't have the Zoom link for it. I'll be sending you that. And it'll be different than this class, right? You're not going to go to this, you're not going to come to the same room. So you're going to be getting your information for the final. You're going to be getting the link for the, the final. And again, it's just 10 o'clock next, or on the 10th. You'll come in at 10 o'clock to the link that I'm sending you for the final, and you'll just kind of hang out. And how that works is you guys will come in, you'll take your quiz, and then either Gabby or Kim, somebody is going to move you in, and you'll speak with either myself or one of the other instructors for a few minutes. We're going to provide you your score for your final. We're going to review your progress notes, and you'll complete a survey, and then you're out of there. And that's it. That's your final. It takes about 10 minutes. Well, once you meet with us, it takes about 10 minutes, but you'll have your quiz and your notes. Does anybody have any questions? And again, you're going to get some emails explaining everything. You'll have the link for your final and to submit your final, the link for the room for the final, and the link to submit your final. Okay. All right. Well, I'm sorry I held you guys over. We ran out of time, but if you all will have a good week.